Hi, welcome to Highlights with Heather. This month we're going to be focusing on the difference between preventative skincare and corrective skincare. So we're going to be talking about what to do with your skin all throughout the ages, in your 20s, in your 30s, in your 40s, your 50s and beyond, and what you should use products and service-wise on how to take care of your skin through the years. Preventative skincare is really trying to prevent damage that is going to occur. So you want to keep your skin in a healthy state. You want to protect it from the environmental damages such as the sun, pollution, smoking. You want to keep it healthy so that it doesn't have the risk to get the sun damage, to get the wrinkles and all of that stuff. Now, if we haven't started early enough, then we go into corrective skincare, where if we already have a brown spot, or we already have acne, or we already have a wrinkle, I'm going to talk to you about different ways to be able to treat that and different services and products that we use that will correct those issues. We're going to go through this throughout the years, all the stages in life, and what you should do with your skincare. So as promised, I'm going to give you the guide to products and services to help guide you through the best years of your life. And we're going to start with in your 20s. So believe it or not, damage is already done in your teenage years. So parents, make sure that your kids are wearing sunscreen. It's the number one thing that you can do for them. But as we start to get into our 20s, we start to lose elastin and collagen production, which collagen is imperative for our skin to be smooth and taut. And the elastin is super important because it allows us to stretch but then snap back into place. So we want to make sure that we prevent losing the elastin and collagen. So number one, definitely wear sunscreen. It's the number one anti-aging product that you can use. I would also recommend starting on an antioxidant, a vitamin C or a green tea, something that's going to help to also prevent outside damage to the skin. As far as services, facials and microdermabrasions are excellent in your 20s. They help to exfoliate your skin, rejuvenate your skin, and protect it from damage moving forward. So it's very, very important in your 20s to make sure that you're preventing so we don't have to correct later. Okay, so now we're going to talk about skincare in our 30s. So we've already talked about in your 20s, you want to prevent and use sunscreen, start doing regular facials, microdermabrasion treatments. We want to continue all that, but we also want to add a few things in. We want to use a retinol on a regular basis. That's a powerhouse for anti-aging. It helps to keep your cell turnover rates sped up. It helps with fine lines, wrinkles, and it's great for preventative. Again, we always want to wear a sunscreen. The other thing we want to add in is a really good moisturizer. Your skin needs that hydration as you start to age. Some things are changing in your skin, maybe your hormones, maybe different things. So you want to make sure that you have that good hydration in your skin. Some services that are also recommended, Botox is, one of the number one services you could do for anti-aging and prevention. Chemical peels, and again, microdermabrasion, a great way to exfoliate the outer layers of skin so that the new skin can form and come to the surface. So keep in mind that, in your 30s, things will start to change, again, with hormones and just your skin will start to age and show a little bit more. So you want to make sure that you stay up with your regimen as well as your in-office treatments and keep your skin healthy for when we go into our 40s. So now we're going to talk about skincare in our 40s. So in our 40s, our cell turnover rate has slowed down more than double than what it was in our 20s. So we really, really have to make sure that we start using something that speeds up that cell turnover rate, that exfoliates that skin, rebuilds that elastin and that collagen. We also really start to lose fullness when we're in our 40s. So products that are recommended is products using hyaluronic acid. That's a super humectant that draws moisture to the surface. It plumps out fine lines and wrinkles. Also adding antioxidants into our regimen now. That antioxidants help to prevent damage further damage and correct damage that's already been done. So when we're in our 40s, we definitely need that. This is also the time when we start recommending using some fillers, starting to fill out a little bit in your cheeks, a little bit in the lower mid face, because again, we're losing a lot of volume in our 40s, so we want to make sure that we keep that intact. Again, continuing with a lot of the other things that we are doing, make sure you continue with that retinol, always that sunscreen, continue to exfoliate that skin on a regular basis with your facials, your microdermabrasions, or your chemical peels. We want to make sure that all of these procedures and products that we're using in our 40s will help to continue to prevent damage happening as we age. So now that we're in our 50s, 60s, and beyond with our skincare, our two main focuses are going to be retention and routine. Retention, we want to maintain the hydration and the firmness of our skin. So at this point, we want to bring out the big guns. We want to use peptides. We want to use ceramides. They help to protect that skin barrier and hold in that hydration and moisture that we really need as we start to age, especially if we're going through menopause or some hormonal changes. That's imperative. It's also imperative, again, to use your retinol. You absolutely want to make sure you have a retinol in your regimen at all stages of life, but especially as you start to get older. As far as services, again, filler is a great option when you're in your 50s and beyond, because it helps to give you that fullness and that firmness back in your skin. Also, we introduce at this point laser treatments. Laser treatments are a little bit more in depth than chemical peels or microdermabrasion, but we kind of need that as we start to age and we're in our upper years. So it's also really good to have a regular routine in your 50s, 60s, and beyond, which includes an at-home skincare regimen and also consistent in-office treatments. These two combined are the best way in this stage in life to keep your skin looking and feeling its best. So thanks for watching this series on skincare through the ages. If you do have any additional questions or you're interested in learning how to take better care of your skin, we do offer free consultations. You can give us a call or schedule online, and we would be happy to teach you and to go through this journey with you on how to treat your skin 20s, 30s, 40s, 50s, 60s, and beyond, and get you on your way to healthy, beautiful skin.